In the United States, heart failure is the fastest growing cause of hospitalization, and many people in other countries also suffer from the disease. World Health Organization statistics show that at least 17 million people around the world die of cardiovascular disease each year, including those who have heart failure.
Are you having any pain anywhere?
Put simply, heart failure means the heart can't pump enough blood to meet the body's needs. With time, the heart weakens until it can no longer pump. Katie Coffey suffers from heart failure. She tries to follow her doctor's orders.
I feel better, and I've been walking a lot, so the more I walk, the better I feel.
Doctors say teaching heart failure patients to take part in self-care is key to successfully treating the disease. This self-care involves taking medicines on time, limiting salt in food, reducing or eliminating alcoholic beverages, regular exercise, maintaining a healthy weight, and if they smoke, stopping. But research shows that 50 to 80% of heart failure patients don't change their lifestyle. Another 30 to 60% don't consistently take their medications. Health professionals say the reason for such a high failure rate is that patients feel overwhelmed by the number and difficulty of these demands. Dr. James Calvin Jr. and other researchers wanted to see if they could help these patients.
We're looking to see whether or not we can change patients' behavior through education as well as helping them learn self-management techniques.
Some patients with heart failure received reading materials from the American Heart Association. Others got counseling in addition to the reading material.
47% of the patients were women, 40% were minorities. So we feel that we put together a population of patients that's representative of the heart failure population of the United States.
Over the course of the study, the doctors did not see much difference between the two groups. In both groups, about 40% of patients were either hospitalized or died. While the results were disappointing, the researchers saw that some patients benefited. Professor Linda Powell is one of the researchers. She chairs the Department of Preventive Medicine at Rush University Medical Center.
Self-management counseling actually had a benefit for the low-income patients, and education actually had a benefit for the high-income patients.
Professor Powell says the study shows paying more attention to the special needs of different patient groups can have an impact. The researchers now want to study the effect of tailoring treatment based on the patient's income. The report was published in the Journal of the American Medical Association. Carol Pearson, VOA News.